Hey everyone, it's Zach with Palantir Research. Palantir wins yet another new deal that continues to solidify their necessity in the healthcare space. So I'll go over the deal itself, but also why this one shows how network effects potentials are huge for this one specifically. Now, for those wondering, I came across this on Reddit so that the NIH awarded the University of Colorado Anschutz Medical Campus and its partners NIH's new Center for Linkage and Acquisition of Data. And working in healthcare myself, I get why this is important, especially around the frustrations of completeness of data, but also working in that context of keeping it secure, and only for those who have agreed and opted in for sharing that stuff. Now, the whole contract itself is for $30 million to the university and its partners, so we don't know exactly how much would be going to Palantir or what that necessitates, but being part of the project itself is huge enough considering this deal is targeting at 18 months for the base, and then that's for the $30 million, but then there's an option to renew it up to 4 additional years depending on funding and of success. Now, the project itself, CLAD or CLAD, is trying to tie in disparate data sources, and that's to get a full picture of patients' lives when they run these health and disease studies. So healthcare data sources are tricky because of their completeness and quality and the security around that. And when they're doing this, they're trying to tie in a bunch of unrelated and differently managed sources like biosamples, surveys, wearable device data, measurements, and EHRs or electronic health records. And these are going to be managed by different bodies, and the context of protecting privacy there is going to be different. But we know who's good at this and who can handle this kind of data, Palantir. But either way, this project is maximizing what is available to them and ensuring they link complete pictures of these patients correctly, of course, for only those who's consented. Now, just so you know, Palantir is officially part of it. They are mentioned as a sub-awardee of this $30 million. Like I said, we don't know the exact amount for them. Now, from my experience working in healthcare data, so no matter what kind of arena you're in here or what aspect, I've been on the healthcare insurance payer side, the ERP implementation side to medical systems. So I was working with their data teams on extracting EHR data and all the headaches with the completeness and quality. But even on the auditing side for claims, where I literally ensure payers are paying and coding claims correctly, which I think is probably the closest example to this kind of project here. So although I was participating on the financial side of these claims data and tying things together, we still had to do the same thing where we're ensuring the accuracy and completeness of these patient profiles, because it is a large factor in knowing if a patient has showed up on a third-party data set and does it paint a consistent picture for their medical history as well as the services that are allowable to them. So stuff like that. You want to get the most complete picture there, because if something is not adding up, it can be the difference between paying out and not paying out a claim that you're supposed to. Now, this project is getting at the same issue, but on the medical research side. Tying in all these different data sources and ensuring they have a complete picture is crucial. Because of a certain group of folks are showcasing symptoms or disease is becoming more prevalent, but if they're unable to tie the common denominator there, it may exist to them on a data source that isn't there or isn't allowable. So it may sound simple, of course, get all the data, tie it together, but when you're managing 1 million folks with changing data sets over time, you want to make sure there's automation in place with the data quality as well as the controls of the security aspect. And because even if the data does exist for a patient, it has to be handled properly, and you can only come to those conclusions when you're allowed to have them. Now, network effect wise, this project is big in my opinion that Palantir is a part of it because first, it's parallel with many other healthcare kind of platforms going around that they're powering. I made a few videos on these other ventures, but for example, Concordance is like the healthcare supply chain side of things where they want a better plan with manufacturers on the hospital side and then also the in-between with the supply chain that they're trying to provide. And these will no doubt live in completely different sources of data, but they still need to be shared. Or another example is just them working with drug data and discovery of the life sciences side of things. Now, this is yet another angle for Palantir that's creating these healthcare platforms with different usages over time. Now, if they'll all be connected at some point is a huge jump in my opinion and speculation, or at least way farther down the line than now. But it wouldn't necessarily be out of this world for that to happen. The more networks they actually set up here and become more ingrained and spread around, one day someone may have the idea to further connect these different separate networks together. Because right now we're thinking about, oh, we need to tie different data sources together, and a lot of different organizations and institutions are handling those. So you're creating the network there. Now, when you have a bunch of these networks together, it creates a whole nother opportunity that gives you a bigger and complete picture, maybe across the whole country of the United States or even the world or multiple countries. Now, that's just a big vision for the future there, but honestly, it wouldn't be easily possible, I think, without Palantir being a common, consistent, constant in the background running these. But right now, that's not their focus, of course. They want to set up these networks right now, but who knows?